A powerful display of the passion, dedication, and emotion that respiratory therapists and their patients share towards advancing respiratory patient care.
It is really a privilege to be back here in order to say what a great venue this is, where patients then can come, hear speakers, ask questions, and be with each other. So this Patient Advocacy Summit is a wonderful enterprise.
Hi everybody, I'm Christina Jensen with AARC TV. The power of overcoming the odds and helping hundreds of patients was on full display at the 4th Annual Patient Advocacy Summit meeting.
The summit is so exciting because it allows people to see that patients and others are still active and they want to work together and they want to provide the richness of the voices that are involved in respiratory care. The provider and the respiratory therapist and the patient and the caregiver.
The AARC Respiratory Patient Advocacy Summit builds partnerships and aligns these groups towards the goal of improving patient care through advocacy, equipment, and services. This summit includes lectures and discussions with respiratory care patients and advocates.
And it was Dr. Huggins calling me to tell me that I've got alpha-1 antitrypsin deficiency.
Len Geiger lost a lot after he found out he had a unique type of COPD, his wife, his dream house, and purpose in life. But then he did 3 key things: reevaluated, rehabilitated himself to the best of his abilities, and above all, he never stopped. But even then, he suffered yet another setback.
So at 35 years old, I had lost more than 60% of my lung function, and I was never going to get it back.
Geiger needed a double lung transplant. In 2002, he got one from a 14-year-old girl who had committed suicide. Her organs saved a total of 5 lives, including Len's. He later met the girl's parents and started working with them to raise awareness of suicide prevention, organ donation, and alpha-1.
Everybody in this room, unless you've been tested for alpha-1, you're at risk for having it. If you have COPD and your doctor has not tested you for alpha-1, there are guidelines that say you should be tested for alpha-1.
Because he has always been a robust responder, as I mentioned, and done very well, it's motivated me to be able to advocate on behalf of parents, spouses, and brothers and sisters, pardon me, who have not done well.
Steve Van Wormer became emotional discussing his son's ongoing battle with pulmonary hypertension. There were times when 4-year-old Lucas would be gasping for breath. Finding out what was wrong was a struggle. The Van Wormers' pediatrician thought Lucas had asthma, but after a 9 to 10 month spiral, it was a guest pediatrician who recommended an X-ray just to make sure Lucas's lungs were clear. After several tests, doctors diagnosed Lucas with pulmonary hypertension. Then he received a blessing, a recommendation to UCLA.
This is really the moment in time, if you think back, when combination therapy literally just came to be at that moment. Thankfully, we got into UCLA. Dr. Juan Alejos is his doctor. Has done great. Has been a robust responder to oral therapies. And like literally within a day, 2 days, 3, it was like instantaneous having a different child.
Lucas was one of the first to receive the combination therapy, and it's been a life-changing success. Now, Steve works tirelessly to spread the word about pulmonary hypertension.
Maybe it's a blood test in Los Angeles or a research project in Japan or something, something like this in Europe, that where all those puzzle pieces come together, that maybe that's going to get us closer to a cure for all patients, not just pulmonary hypertension, but in diseases like this.
You can find out about trials available that could be right for you or your patient by visiting phaware.global.
It explains exactly what you do and what an integral part you are of the team that takes care of every pulmonary patient. Congratulations.
Registered respiratory therapist Tanya Lofton was recognized as the 2018 National Patient Advocacy Award winner.
It
basically is an award that is given to respiratory therapists who excel in patient education, patient support, and trying to be their advocate. It was a big deal. I cried when they told me and was very excited.
And the award shows that you need three things. You need unity to make your pulmonary health better. So that's the pulmonary therapist working with your medical team, working with the patient and the family member. So this is all about teamwork for better pulmonary health.
The day wrapped up with advocacy organizations discussing the challenges they're facing with patients and what you can be doing.
We live in a great time when there's lots of new innovation, lots of incredible medication and devices that are coming to market, but there's a lot of roadblocks that are being put up there, and so patients can't necessarily access them. So we try to bring together physicians to help inform good policy making, ensuring that whatever policies are made, whether that's at the health plan level, the regulatory level, that patients are able to access whatever it is that their physician believes is the best course of treatment for them.
Lawmakers have a perspective, and fundamentally they all want to do what's right by their constituents, but they don't have a unique perspective until we present it to them. So it's really important that patients share their stories with their lawmakers so that they have a better perspective when they're crafting public policy that's meant to protect or help people in their districts.
The groups represented the Alliance for Patient Access, the ARDS Foundation, Cystic Fibrosis Foundation, and the Physician Patient Alliance for Health Safety. They took questions from the crowd, a chance for the patients and loved ones to get advice.
What about when they won't fill your prescription and then it's late and the doctor can't be reached?
And then for 2019, we'll be adding patient access. We found that that's an issue that faces physicians trying to get the medications to their patients, as well as patients trying to get the right medications. Some of them can't get it because their health insurer doesn't cover it, wants them to go through various procedures to be able to get it. Sometimes they just have real basic issues in terms of even just going to the pharmacy and picking it up, or the amount of co-pays.
Bottom line, this is a day that respiratory patients, loved ones, and clinicians should not miss in the future.
It's a critical thing to do for patients and families, to give them information and education, and I feel that often in the steps along the way that patients, the reasons why they have not enough information and knowledge about their own health care is because there's not enough of events like this that are geared towards giving this information to patients and empowering them and making them better advocates for themselves.
For more information on patient advocacy, legislation, and resources, visit the website on your screen. For AARC TV, I'm Christina Jensen. Thanks for watching.